Good morning, you guys. I just want to give you some highlights of the count policy. This is the first pass at this. There will be changes coming through, like that we said, the final will be out in January. Okay, so we're just gonna review about foreign bodies during surgical procedures, the count expectations, and then the changes that we're gonna see, because there are gonna be some things that are gonna affect all services. And it's not just a practice change, it's also a culture change. So I want you guys to keep that in mind. It's hard to tell somebody to do something different when they've been doing the same thing for 15 years. Okay, so focus, right? Eliminate distractions. We all know that we're in the process of multitasking when we're in the operating room, or parallel processing, right, is what we're calling it. But when you're counting, you want to make sure you're limiting distractions, right? Don't take gloves, don't answer questions. Be mindful that the count is really important. And I know some people own that and some people don't, but just remember, like, if your count is incorrect, you're putting that patient at risk for an x-ray at the end of the count. So no music, limit conversation, don't answer the phone, don't answer pagers, don't take gloves, don't take items. If your count is interrupted or if there's a discrepancy, then repeat it, start it over. I know multiple people have done this in the past, but just, so instrumentation. All procedures in which a major body cavity is entered regardless of age or weight. Now this is stressful, or for patients with the peds service when we have little bitty babies and we're doing these big, huge counts. But unfortunately, our policy states if you're doing an open case on an itty bitty neonate, you're still counting everything. And that's what the policy is, okay? Needles and sharps. All right, so all needles with the exception of microneedles, 9 millimeters or smaller. Who can tell me what is 9 millimeters or smaller? 9, 10, thank you. Or smaller or microscopic cases, so like a lot of eye suture, we're not counting those. Knife blades, hypos, bogey tips. Miscellaneous countable items. Any item that is small enough to be retained, whether radiopaque or not limited to, and then there's an attach to this. So here's where the big change is gonna come. A lot of things that we're not used to counting as it relates to miscellaneous items will be counted, like wet clips. Right? Wet clips are going to be counted. The cartridges are going to be counted. This is going to affect a lot of services, but your cartridges are going to be counted. All right? The hemoclip cartridges. Does everybody know what that? Hemoclip cartridges, wet clips. Sorry, we use wet clips. Wet clip cartridges. Those things are going to be counted. And I know, and I've worked on the transplant service, I've done trauma cases. It's a new process. It's a culture change. All right, so stop, think, and focus. Stop, think, act, and review, and report results. That's something that we're already doing now. We just wanted to push that out. Okay, so our counting procedure should go like this. So circulator and scrub must visualize and count together. What does that mean? That means if I'm counting with Dave Munn and I said, and I say, Dave, I have 4 hemostats. He says, Dave says 4. I say 4. I show him 4. A lot of people transpose things incorrectly on their count sheets. I've done that. And you might say one thing, and write something different. So now your scrub is going to be helping you be accountable with what you're writing down on your sheet. So for instruments and countable items, so if I'm giving suture and Molly says that's 2, then I'm writing 2 and I'm showing her 2. So that's going to be different. Jamie, that's coming. It's in process. So we're trying to figure out what things will be on that board, but that is for that very reason. So yes. So the visualize, that's why that's underlined, because that's something else that we're potentially going to be going to. Correct. We're trying to figure out whether that's going to be a whiteboard or an electronic version. Everybody has a big screen in their room, It has to be something that everybody can see. So we just don't know what that's gonna look like yet. That's a good question, but it's coming. Okay, all right. So count out loud, simultaneously, and repeat back. So you're doing a repeat back and verify for your counts. Each item should be separated and peeled off individually, not 5. We've seen that happen for some people. All packs on the sterile field should be open for the count. So you know how you get things in your pack and they are prepackaged, like sometimes you get clips and things like that. So, what's that? Knife blades, yeah. So you're not counting your packages, you're opening your items. Sometimes you get things that don't have items in them. So you just want to make sure you're opening all of your packages. We count all needles by size and name.
That's not a change.
That's not
a change. I know this is a change or a different process for some of our travelers that come here, but that's how we count here. Okay. Any miscellaneous items that are small enough to be retained should be counted. This is just a reiteration of what we just went through. All parts, including removable parts and broken pieces, should be accounted for before and after the procedure. How many people have ever seen a needle break in the middle of surgery? Right. So if your needle breaks and you don't get it all back, you have an incorrect count. Does everybody understand that? All right, so this is what our new count sheet is going to look like. And this is going to be the biggest practice change for the circulator question. The front of this count sheet is the same for everyone. This is going to be the standard. Your service-specific count sheets will have your instruments on the back. So if you're doing like ortho, neuro, it's still the same count sheet. If it's plastics, general, GYN, that's all the same count sheet. So that kind of goes along with that. So that part is not going to change as far as your service. This, however, is the standard. All right, so there are some things that are not listed on the sheet. This isn't the final sheet. We can make adjustments to this because, like I said, the Practice Council came up with this sheet from things that we use most frequently. So I think we're supposed to be adding cotton balls to the front of this, and that's all. So that will that is a change that's coming. What's that? Staple loads. Okay, we can add it. We can add staple loads.
in MacPads.
So we can add the hemoclip cartridges too. Somebody just helped me remember that. But I knew it was cotton balls, staple cartridges, and then the clips, right? Okay, so that's 3. And we have 1, 2, 3, 4, 5, 6, 7 blank spaces. So right now you can still write those things in, okay? What you'll find pre-printed on the sheet that wasn't there before are a section for baby laps, a section for your actual quick clot, your Z-fold, and then a section for your trauma pads. The patties are all here, but if you'd like the quarter by quarter added, we can do that too. And then the needles section is essentially the same. So the biggest thing that you're gonna see that's different, and all your count sheets will come in color, are this yellow section right here. This yellow section is for your final counts. So let's say Jason and I are counting, and we're doing an airway case. We count essentially 10 Raytech. So you'll have 10 Raytech here. So at the end of the count, I'm gonna write 10 here. Let's say I open 20 pack of Raytech. You're gonna have 20 written right here. The final count is just a final verification. Now, the next thing you guys see is cross-off sponges should be included in the final counts. So let's say I'm doing a hepatectomy, oncology, or transplant, and I have 100 lap pads. Well, I cross off, let's say, 60 laps, right? And those are in multiples of 5. And so I cross those 60 laps off. My final count is still going to be 100 because those things have to be included in your count. Does that make sense? We're used to just verifying what's at the field, but now we have to verify what's in your room. Piggybacking on that, you have to make sure all countable items are remove from your room before you start. It's gonna be more important now than before because we find clamps, scissors, things tucked on things. You have to make sure that stuff is gone. So at the end of your cases, you have to make sure all that stuff leaves your room. Okay? Any questions about that? Go ahead.
We have a large case, and the last part, we don't have enough cultures, you know? So what do we do? What is the right way to take the 5 down, roll them up, put them on the floor, put them on the table, and after we go back to verify the 100, do we have to go back and count each individual one?
No. So your initial verification is you and I are counting 5 in a bag, 5 in a bag. I roll that up, that's verified. If you feel like you're gonna have 120, 200 laps, I don't expect that stuff to hang on the wall because the wall will come down, right? So once you verify it, it just has to be in the room. If your count for some reason is incorrect, you have to be able to go back to all that stuff. So that is the plan for that, okay? Go ahead.
I guess I just have an issue with, the residents, are still kind of interrupting our count a lot with their pages.
People can only make you do what you do, and you can't do anything that you don't wanna do. So if you cannot answer a page, you're not answering a page, you have to take care of your count. They can't start until you're ready. They can't start until your count is done, and you have to own.
Dated uninterrupted time for the count, and that the surgeon will be actively involved in communication of when that appropriate time is. Meaning, the surgeon feedback we got was sometimes the staff are trying to be proactive and counting ahead of time, when really it's not the most appropriate time to be counting. And so the surgeon needs to be part of that discussion of, okay, we're gonna do a closing count now. We'll give you 1 stitch and we're gonna count, and it's gonna be uninterrupted. And that's going through our new quality, safety, and regulatory committee that reports up to the Perioperative Executive Committee. And that's something that's gonna be a non-negotiable. So if a resident interrupts your count, you're gonna say to the resident, I'm sorry, but I cannot stop. I'm continuing with my count. You know, unless the patient is bleeding or there's something like that going on with the patient, you're not stopping to answer a page. You're not stopping to answer the phone. You basically ignore them.
So the other big change for the count sheet is that we are no longer marking things off, meaning we are no longer subtracting things from the count. So what that means is you will have to maintain all of your items. If something falls off the field, it's included in your count. If needles fall off your field, they need to go in a specimen cup until we get, we have a we have a needle boat with a clear top, so you'll be able to put those things in there. Those things are all included in your count. So you can pass the needles off, they still have to be verified in your final count. But we're not subtracting them anymore. Does everybody understand that? Because that's the other big practice change.
So if you pass a scissor off?
If you pass the scissor off for whatever reason and you counted it, it's still counted. So you have to have a visual verification with you and your scrub nurse as to, okay, 15, 16.
So you don't want an indication that it's no longer on the field?
Correct. We're not subtracting anything off the count sheet anymore. And we are behind the times on that.
Yeah.
Like, yeah. So no subtraction. This was the biggest part. So we talked about this, the adding and subtracting. The clear lid needle boats will be coming. Everybody knows you can't refuse a count. If I ask for a count, your scrub asks for a count, you count. There's no refusing of a count. Everybody knows about not giving anesthesia, radiopaque gauze for dressings. You know about that? That came from a near miss that happened. Linen waste, medication should not be removed from the OR until the counts are completed and reconciled. Everybody knows that. Quick clock sponges should be counted. They're on the count sheet. And it's just a reiteration of opening all your sponges when you're counting and putting them in the bag. 5s and 10s. 10s are for Raytech, 5 are for laps, 4 for towels.
Don't put 10 laps in one counter bag. I know people have tried to do that to conserve. Don't do it.
But if
We
Bella.
count by 5, you put 5 in the pocket.
Correct, because it makes it hard to verify. If I'm coming to relieve Bella on a huge liver case, then I'm assuming if all these laps that are down here are 5, right? If my count is wrong, it's because somebody might have thrown 10 in there, and that's why we want that to happen, okay? Throw packs, we have the signs. Everybody knows about our throw packs being in. And the communications form on the bottom, if you're putting things in and taking things out, putting things in and taking things out, you should put that, for timed and initial for placement and removal. So that means if I have 5 laps in and I'm putting that in, time it, put it on your count sheet, and when it comes out, you initial it, okay?
How many scrubs write stuff like that on their back table?
Thank you.
You write it on your back table that you've got 3 laps.
And we did.
We are going to be working on a way to formalize your camis that you worked on so hard, in a way that you can have it sterile on your field, so we can have a sterile handoff from one scrub to the next.
So this is gonna be in the packs. This camis is gonna be in the packs, so you can write this stuff down. So now it's not just a verbal, it's an actual. So when you're, for the change of shift, you can put your name, the time you change shift, and the status of all these things. So counts, allergies, medications, instruments, equipment, and specimens will be there for you to pass. Nothing has changed with the orange sheets. Just so you know that, in the count policy, there will be detailed instructions on how to use it for our new travelers and people in the environment. If you have an incorrect count and you get a x-ray, what's the process after you get the x-ray? Do you wait for the radiologist to call back, or you let the patient leave? There we go. This is essentially what this slide is saying. This is just a reiteration of everything that we just went through, except final counts are not required when you have a patient expire. Not required, but sometimes people still do them anyway. It's not a bad thing, but you don't have to.
You do want to account for your sharps to make sure your sharps are disposed of appropriately.
Are we counting solid waste?
No.
No solid waste. And then all items that are cut have to be counted for in entirety. Umbo, pin rows, vessel loops, all those things. Okay. And that's it. So this is the end. Thank you guys for being so attentive.